Are you frustrated by all the different options there are for hearing aids? You're not alone. I've helped thousands of patients cut through that noise, and today I'm going to help you find the right path for your hearing health care. I'm Dr. Garrett, founder of Timpanogos Hearing and Tinnitus here in Utah, where for over 20 years we've been helping people reconnect with life through better hearing. If you're trying to figure out which hearing aids are right for you, again, you're not alone. There are just so many options out there. But don't worry, in this video I'll walk you through the 4 most important factors to consider when choosing hearing aids, so you can feel confident in your decision and get the results you deserve. There are hundreds of hearing aid options on the market today, from prescription hearing aids, over-the-counter hearing aids, big box store brands, and more. Even as a hearing aid doctor who studies this every day, I'll admit it's sometimes hard to keep up with. So how is anyone else supposed to make sense of all of this? That's why today I'm going to break down 4 simple, powerful factors. Let's start with the first one. Number 1, the style. The style of your hearing aid impacts more than just how it looks. It affects how well it works for your unique hearing loss. Let's say, for example, you have a high-frequency hearing loss, but your low and mid-frequency hearing is still pretty normal. We see that all the time. Now, a receiver in the canal hearing aid is usually the best bet for that. It's going to boost those high pitches that you're missing without blocking the natural sounds that your brain already handles well in those lower and mid frequencies. But if you go with an in-the-ear model, you will end up with a plugged-up feeling that we call occlusion. When you talk, your voice is going to sound like you're in the bottom of a barrel, kind of like the sound you get when you stick your fingers in your ears. And you talk and you know how your voice sounds like you have a cold. You're going to experience that all the time with occlusion. So don't choose a style based on appearance alone. It needs to be chosen based on your unique hearing loss. Number 2, the features. Today's hearing aids are smarter than ever, but not every feature is right for every person. Let's start with the big ones. First, rechargeability. Traditionally, hearing aids were powered by very small little batteries that came in little packages. You'd have to take the batteries out and stick them in the hearing aid and change them about once a week. Now it's gotten even worse because those battery packages are required to be child-proof. Many patients, especially those with dexterity issues, find rechargeable hearing aids much easier. You just pop them into a charger overnight. No fiddling with batteries. Number 2, Bluetooth streaming. Want to take phone calls or listen to music straight through your hearing aids? With Bluetooth LE audio, you will get crystal clear streaming with better battery life from your phone to your hearing aids. Plus, new features like Auracast will let you stream audio from public places like churches, theaters, and airports right to your ears. That's going to be a game changer. Number 3, background noise management. Most patients tell us, I want to hear better in background noise. Modern hearing aids use tools like directional microphones, noise reduction algorithms, and even artificial intelligence to help you focus on voices and tune out those distractions. Number 3 on the list, accessories. Even the best hearing aids can perform even better when coupled with the right accessories. Want to hear the TV clearly without blasting the volume? You can use a TV streamer to send the sound directly from the TV to your hearing aids. Having trouble in noisy restaurants or in meetings? Even with advanced algorithms, that can sometimes be a struggle. Using a remote microphone to transmit speech right from the person you're talking to straight to your ears, that's awesome. Not a smartphone user? Some models will come with a remote control. Even if you don't need these accessories right now, you might in the future. So it's smart to choose a hearing aids that are ready to grow with you. And number 4, the hearing care professional that you work with. This one, honestly, is the most critical piece of the puzzle. You could buy the most advanced hearing aid on the market, but if it's not fit and programmed correctly, you may never experience its full potential. At Timpanogos Hearing and Tinnitus, we follow what's known as best practices. They're evidence-based procedures recommended by top professional organizations like the American Academy of Audiology, the Academy of Doctors of Audiology, the American Speech Language Hearing Association, and the International Hearing Society. Let me explain what that actually means to you. First, real ear measurements. This is a must. We place a small microphone in your ear canal to measure exactly what the sound is doing in your ear canal. That allows us to adjust your hearing aids in real time to match your hearing prescription down to the decibel. Most clinics don't do this, but we do it every single time. Second, custom feature tuning. Features like noise reduction, speech enhancement, and Bluetooth need to be personalized for you. That's what we do based on your needs, lifestyle, and hearing goals. Next up, follow-up and support. Your brain will need time to adjust to hearing again. That's why we include multiple follow-up visits to check your progress and make fine-tuning changes to your devices. We don't just fit you with hearing aids and send you out the door. We'll be with you every step of the way. Bottom line, person fitting your hearing aids is just as important as the hearing aids themselves. Sadly, industry surveys show that only about 30% of hearing clinics are following all best practices. In any other healthcare field, that would be known as malpractice. Make sure you ask your providers if they're following every recommended best practice. So let's recap the 4 things you need to remember. First, style. Choose a hearing aid that works with your hearing loss, not just one that looks good. Second, features. Know which technologies will actually make a difference in your daily life. Third, accessories. Keep your options open for tools that can enhance your hearing experience. 4, provider. Work with someone who follows best practices and takes your hearing care seriously. Before we go any further, if you could do me a huge favor, I'd really appreciate it. If you found this information helpful today, give this video a thumbs up. Subscribe to our channel so you don't miss any of our videos that we produce regularly. And lastly, if you know someone who needs this information, please share this video with them. Thanks for watching, and I'll see you next time.